Introduce Sara Flores to you. Sara and I have known each other for a long time because we share a relative in common. She is a midwife and spoke to me, or I kind of gave her like wink, wink, nod, nod. I used to talk to you right when I was getting ready to have corazon, my baby. Anyway, she's a strong woman that I've always looked up to. Sara Flores received her calling as a healer during her childhood in inner city Detroit during the 1980s. Her first tools of healing were plants from her mother's garden, prayer, and improvised ritual. She was called to midwifery specifically as a teenager and has been doing her life work as a midwife for 17 years. Sara is deeply dedicated to reclaiming ancestral healing traditions while weaving her education as a nurse, nurse midwife, and nurse practitioner into her services to find justice, balance, self-love, and empowerment in our own body and our own communities. And she didn't mention this here, but she is also the founder of Reclaim, which again stands for Resisting Colonial Legacy and its Impact on Medicine. Thank you, Sara.
Thank you. Good afternoon. I first want to thank Carla for this amazing, amazing vision that she had in the middle of the night, may I add, to which she brought me in early in the morning after that middle of the night vision. And it was a call to fire. It was a call to action, and I'm grateful for the opportunity to have been able to respond to that. I want to thank Movement Generation for allowing Reclaim to partner with you. And can I just give a shout out to all the Reclaim folks in the house? Let me hear who's here. Reclaim. So this is a special moment because this is really Reclaim's debut. So it's not just about Reclaim being present, it's about Reclaim taking off, and you all are part of that. So I want to just start by reiterating what has already been spoken about our need to have a call to action for resistance, resilience, restoration, reimagining, and reclaiming. And what I want to take a few moments to talk about is a metaphor which we have inherited through colonial legacy. And that metaphor is that our bodies are machines. Okay? So when I say that, I want us to all go deep inside ourselves for a moment and find that place, wherever you hold it, in your heart, in your belly, in your head, your third eye, some meridian, some chakra, where you keep the most sacred truths of who you are. Find that place and sit with it for just a moment, whatever that sacred truth is. So as you hold that truth inside of yourself, let's talk about what it means that we were told that our bodies are machines. Because I'm sure as you tap into that place, you feel that it's connected throughout your whole being, and perhaps connected to your neighbor, connected to this room. We are connected. Now, colonialism, which was really introduced on the planet thousands of years ago, truthfully. But if we talk about colonialism on this land, we can talk about hundreds and hundreds of years ago. And what we're talking about is the coming of a way of thinking to our core being, right? An introduction of a new way of thinking that told us that we were not whole, that we were actually sick, savage, wrong, worthy of death for who we were. And that our bodies were just a sum of our parts. And what I mean by that can easily be demonstrated by walking into any medical school, nursing school, midwifery school, pharmacy school, and looking at your typical diagrams of the body, or even the way you're taught about the body. we're taught about the body and those systems as parts. Now we're learning the endocrine system. Now we're learning the cardiac system. Now we're going to look at the pulmonary system. Let's look at the reproductive system. So these are parts. So colonialism introduced that idea to our indigenous traditions, that we are parts, we aren't whole. So let's fast forward to the legacy of colonialism, which essentially is biomedicine. It's maybe called Western medicine by some, maybe called big pharma, might be called the typical hospital that you go to get your business taken care of because you have an emergency. Whatever you call it, I'm going to use the umbrella term biomedicine today. Because biomedicine is the legacy of colonialism. Does that resonate with folks?
Yes.
Okay, so we were told that we were just the sum of our parts by colonialism. So biomedicine has taken that to the next level and told us that we have to pay to have our parts diagnosed, which makes us essentially paying for a mechanic to fix our machines. And the way this relates in particular to midwifery and to my work is that the term reproduction is a capitalist biomedical term, right? The term labor is a capitalist term. How many of y'all have had babies? You worked to have that baby, didn't you? I give my respect for what you did. Did you labor like you were on a factory line? Did you do something in some way that was already pre-described for you? That the parts just fit in a linear way? Did you? No. You didn't, right? My father worked on the factory line in Detroit for 30 years. And I have much respect for all he has done. And he is suffering from Parkinsons now, dementia, soul loss. He's suffering. And that has to do with being dismembered by the factory mindset. So going back to the semantics, you didn't labor. You didn't reproduce because you gave birth for yourself and for your own children. And reproduction is something that is meant to be done for capitalism. So I just want to give you a couple terms, right? Wow. Thank you. Delivery. What do you deliver? To who? To the mechanic. Your machine is delivering to the mechanic. Wow. Okay? Incompetent cervix. Really? So those of us who have cervices in this room, do you think your cervix could be incompetent? What does that mean? That's a biomedical term that has been used to tell us that we can't keep our babies inside. It's incompetent. Fetal intolerance of labor. That's the #1 reason for cesarean section in this country right now. So that means that baby, the fetus, was intolerant of the labor process. Amen? Yes. That's what baby's telling us. This is not working, people. Labor? Why are you trying to labor me? And the result, being a C-section, certainly is a whole nother topic. Failure to descend. The baby doesn't come down. So again, a term of biomedicine that's telling us our bodies are failing us. There's a failure. The baby didn't drop. Failed home birth. A very typical term used in the hospital, which means you couldn't get the baby out at home, you failed. Now you're coming into the hospital. Inadequate pelvis. I could go on. Failure to progress. Even pain. So these are the semantic legacies that we have inherited from biomedicine. So I want to just take you from biomedicine to another system in our culture that is very related, that I think many of you might be able to understand when I talk about the prison-industrial complex, right? So the prison-industrial complex, being a system that specifically uses government, private interests, and prisons as solutions for social, political, and economic control, right? And the prison industrial complex relies specifically on racism, classism, sexism, homophobia, human rights violations, and overall oppression of human beings in order to perpetuate its vision of prison, essentially. The biomedical industrial complex currently uses pharmaceutical companies, insurance companies, private hospitals to perpetuate this same system of oppression that relies on sexism, racism, homophobia. Are you all with me on that, right? So the prison industrial complex has a movement that has been forming to abolish it. And are there prison abolitionists in the audience here? There's folks who know about that movement, right? So I bring it up because we have a similar impetus to dismantle the biomedical industrial complex. Who wants to do that? Yeah. You feel that? So, how about we do this? We replace the national healthcare system, and I appreciate what Atava said about healthcare. We replace that system with our indigenous and ancestral traditional healing models. We replace it with reclaim. Reclaim being the act of resisting that colonial legacy and its impact on medicine. So we get to a place where, as Carla mentioned, in not just emergencies, but on a daily basis, we rely on our communities, our families first, then our communities, and then larger pods of healers to be able to say, well, I need to see the acupuncturist today. I need to see the massage therapist. I need a sexological body worker. I need a doula. I need a midwife. I need a chiropractor. Oh, guess what? I know who all those people are because they're right here in our community. So the vision of Reclaim is to really bring forward these healers from the margins to the center and allow for us to actually reinvent the idea of healing our communities. So with that, I want to just briefly transition into speaking about midwifery in particular and how I came to this work. I was called as a 17-year-old to midwifery from a very specific book called Spiritual Midwifery. Many of you might know it. And I'll tell you, I looked at that book, I saw a lot of people looked great, having babies on a hippie commune in Tennessee. I thought, yeah, wonderful. But you know, I don't look like those people. And my people don't look like those people. So I guess I can't be a midwife, because those are midwives. So I planted that seed somewhere in my head that, well, the calling is there. I'm a midwife. I saw the book, a baby coming, made me so happy. I thought this is what I have to do. But maybe I'm not cut out to be a midwife because I don't look like these people in Tennessee. Well, nothing stops me when I get a calling. So I went to Tennessee and I talked to them. Like, you know, what's up? You all are midwives. How do I do this work? And I was really led by elders at that time to seek the balance of learning about biomedicine and traditional healing. And I was guided at that time to become a nurse, and eventually a nurse midwife and a nurse practitioner, and to hold that space for our communities to have access to healthcare in the way that they deserve it in the hospital, but to also provide resources outside of the hospital. So after I completed that training and came full circle as a midwife, and realized, yes, we don't have to all look like they look in spiritual midwifery, I've come full circle and realized that it's also about giving access to those traditional healing methodologies outside of the hospital for those who can choose to both pay in and outside. So when I say pay in and outside, I mean we have insurance options, right? We have Medi-Cal, we have some private insurances, but we also need to pay out of our pocket for healing traditions. So when Reclaim came to me as a vision, I thought, well, why don't don't we just replace insurance with these pods of healers? So why don't we just pay into a pod at an annual time, and then we have access to all these healers for a small copay? Would people want to do that?
Yes.
People would want to do that, right? So that was my vision at that time. So as my education continued as a nurse midwife, nurse practitioner, people got very uncomfortable with that vision within the biomedical industrial complex. And I just want to bring that up because I want to talk about how much is at stake if we don't put our money and our resources into supporting our healing traditions. Right now I work at Sacred Birthplace, which is a freestanding birth center in Oakland, and I'm a home birth midwife, and I'm a nurse at UCSF. So only one of those jobs is legal. Guess which one it is? The other jobs, the other work, which are not jobs or my life work, I practice outside of the scope of legal support.
Yeah.
To be a home birth midwife means you are practicing illegally. So we're not talking about hundreds of years ago and our brujas and our parteras and our midwives being burned at the stake only. We're talking about right here, right now, where it's actually imperative to support these movements like we're doing today and support one another's work. Because it is actually a possibility that any of us could walk out the door and be arrested for the work that we do. And it actually happens, especially to midwives, truthfully. So with the vision of Reclaim, with the vision of resisting colonial legacy and replacing biomedicine with reclaiming, I also ask for all of you to go back to that place inside of yourself where you have that sacred knowledge. And as other panelists have said today, as all of you already know, you have that wisdom inside of yourself. So when you reclaim, remember, and go back to that space, I want to just leave you with the thought that you are not the sum of your parts. You are whole. We are whole. And that our bodies are not machines. And the brief examples I gave of the way language in birth culture has told us we're machines can be applied to so many other things. This is just one example. But do that self-assessment piece about how many times you've been told that your right hand and your left foot actually aren't related. Or what you think and what you feel, that stomach ache, actually don't have a relationship. And when you can find that, truthfully, you are whole, then I do feel very strongly that our work as healers has been done. And as Ataba mentioned, then you might seek the ways in which you do need a healer to kind of tune up some of those areas, but the healing is inside of you. And if we remember this, we have successfully overcome the colonial legacy. Thank you.